So we have known from the very beginning of the pandemic hitting America that the number of cases and the number of deaths are certainly not the actual number. Now, depending on who you ask, they are an undercount or an overcount. From the very beginning, Fox has been implying, sometimes in subtle ways, sometimes in insane conspiracy theory ways, that the number has been artificially inflated to effectively count everyone who has died from the beginning of this as if they had died as a result of coronavirus. The studies that are being done now show that that is probably not actually the case. So let's take a look at what the Washington Post has been able to put together by counting excess deaths over and above what we would expect to have happened during this time period. So in the early weeks of the coronavirus epidemic, the United States recorded an estimated 15,400 excess deaths, nearly 2 times as many as were publicly attributed to COVID-19 at the time. Now, I understand some people are going to be hesitant to take those numbers and say that they're due to coronavirus, to say that it's too much of a leap to immediately say that. Well, they acknowledge that. They're being very careful in the way that they're talking about this. They say that these numbers could include people who died because of the epidemic, but not from the disease, such as those who were afraid to seek medical treatment for unrelated illnesses, as well as some number of deaths that are part of the ordinary variation in the death rate, because it will not be constant from year to year. The count is also affected by increases or decreases in other categories of deaths, such as suicides, homicides, and motor vehicle accidents. And let's just acknowledge that while the number of motor vehicle accidents could hypothetically have been affected by the pandemic, people doing far less driving seems like those numbers would be lower than at a similar period last year. But anyway, we're going to have more numbers for particular areas. Jordan, so far, what do you think about this? The possibility that in this 5-week period, this is just the early 5 weeks, potentially up to double the deaths might have actually happened as have been recorded so far.
Yeah, I mean, not hard to believe. And it also reflects like a couple different things about the early response, right? So we knew in December that this was developing, and the Trump administration had 17 administration staffers embedded in the World Health Organization that were relaying information back to the Trump White House in real time.
Yes.
Back in December and early January. They knew this was coming, right? So Trump, it was reported extensively, sought to, downplay the severity because it's an election year. And he saw an increase in case counts as likely leading to reduced chances of getting reelected. So they sought to slow roll testing rollouts. They sought to slow roll responses to this. They downplayed the severity. He said it would just miraculously go away. All of these different things, right? So we were completely and woefully inadequately prepared for this. And now we're seeing the manifestations of that. We're seeing probably way more people die than expected, partially because, we didn't have sufficient testing. People weren't aware. And people probably before people even knew really what it was or how to detect it or look for it, probably were not counting those in the death tolls. Mm-hmm. Across the board, I mean, there's like a big data problem in medicine in general. It's not always consistent in your reporting mechanisms and how data is shared and stored. So all of these different things compound the issue, and that's what we're seeing now. In a retroactive application and analysis, we're seeing spikes in these death rates. This is alarming, especially now as we're probably not even at the peak infection rate. Mm-hmm. That's what's most alarming. We're seeing way more deaths now than expected, going into probably what might be the peak infection rate.
Yeah, and there's no way to know for sure. I mean, they're doing what they can to try to give us an idea of what the range might actually have been, but they're not saying definitively these people died as a result of coronavirus. I mean, they do talk to some individuals. There was one woman who said that they didn't want to send their father, who had coronavirus, to the hospital to die alone. They were afraid they wouldn't be able to see him, so he died at home. And he has not been counted. That's just one individual. It's anecdotal, which is the exact opposite of what they're doing here. But that is sort of how this plays out, that some individuals would have never been tested. They would have gotten sick. They had no one to help them. They die at home. I mean, these deaths are coming from something. Really briefly, let me show you one picture. So this is the spikes that were seen in a number of different individual cities. For those of you on mobile, I apologize. This is going to be nonsensical to you. But look at New York there. So you're seeing that the lighter orange is the total excess deaths. So the darker orange are the ones attributed to coronavirus. Now, I understand some people are very hesitant to say those extra deaths are from coronavirus. Was it Godzilla? What exactly was happening in that period of time that was killing so many thousands of additional people, if not coronavirus? Was it bad burritos? What was so deadly in that period of time that wasn't there the weeks before it? I mean, and again, some people, especially like personalities on Fox, for 2 months now, their identity has been, no matter what happens, we're going to say that the number of deaths isn't high enough to impress us. It's only one Vietnam so far. And anyway, it's not Trump's fault because they, like you said, they see it through the electoral lens of how is this going to impact his reelection chances. And so they're never going to acknowledge this. But people who are worried about this, who want to stop future pandemics, they are looking at these numbers. This is not definitive. There's going to be future tests and everything like that. But as bad as it already is, and I personally would count 55,000 plus Americans dying in just the period of a couple of months as an absolute tragedy, perhaps the biggest of our life domestically, it looks like it's actually worse than that. We just don't know how much worse at this point.
Yeah, I mean, I don't know really what to say other than that's horrifying. And I just wish that people would have taken it seriously. I wish that Fox wouldn't have downplayed the severity because, even though you or I or your viewers might not watch Fox, millions of people do. And those people believing that this wasn't an issue likely led to the spread of it. That's why they're getting sued, or likely being sued. It's just, you can do so much, but at the end of the day, if it's not a collective effort, we're only as strong as our weakest link. And that people would just willfully ignore and even in some cases flaunt guidelines for social distancing or stay-at-home orders. They're just putting everyone else in harm's way. And, a lot of people who might otherwise be with us are not now. So it's not just about staying home to protect yourself. It's about staying home to protect those around you.
Yeah. Yeah, and the sad thing, too, is that this is not a thing where, and you have to keep saying this because you hope that eventually it'll get through to some of these right-wingers. This is not a thing where you just get to decide for yourself what risk you're going to have of contracting or dying from coronavirus. That is not how it works. By you putting yourself out there, you put everyone you come into contact with later potentially at risk. And we're 2 months into this. We're many tens of thousands of deaths into this, and they still don't accept this. Just yesterday at his press conference, and look, we're trying to cover it less. We're literally not doing any stories about his press conference today. Trump said we're going to reopen the schools because kids seem to do pretty well with coronavirus. Except the fact that they can get it and then spread it to every one of their family members. It's how many grandmas are gonna die because their kids are forced to go back to school and then they eventually spread it to their parents and to their it feels so pointless in the face of this horrendous daily tragedy that we're experiencing to try to break through to people whose entire worldview has been shaped by a lack of understanding, respect, or concern for science. For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/thedamagereport. And you can ring the bell wherever it is so you don't miss anything.